Experiencing unprotected sexual contact can bring a lot of worry and uncertainty. It is natural to feel anxious and wonder what your next steps should be. When it comes to testing for sexually transmitted infections, or STIs, after unprotected exposure, there is not one single answer for how soon you can get tested. The timing depends on the specific infection you might have been exposed to. This is because each STI has what is called a window period, which is the time between exposure and when a test can reliably detect the infection. The body needs time to react to an infection by producing antibodies or to allow the viral or bacterial load to reach a detectable level. For example, chlamydia and gonorrhea often have shorter window periods, sometimes detectable as early as 7 days after exposure, though a 2-week wait is often recommended for maximum accuracy. HIV, or human immunodeficiency virus, testing can vary widely. While some advanced tests can detect HIV within 10 to 33 days, many people are advised to wait around 3 weeks to 3 months for antibody tests to be most accurate. Syphilis can typically be detected 3 to 6 weeks after exposure, and herpes tests for antibodies can take even longer, often 12 weeks to 4 months. Given these varying window periods, the most important step is to consult with a healthcare professional as soon as possible after unprotected exposure. They can help you assess your risk factors, discuss the specific STIs you might have been exposed to, and recommend the appropriate testing timeline for your situation. Be open and honest about your recent sexual activity so they can guide you accurately. Understanding these window periods is essential because testing too early might lead to a false negative result, meaning the test indicates you are not infected when you actually are. This can give a false sense of security. Sometimes, follow-up testing is recommended even if initial results are negative, especially if you tested during the early part of an STI's window period. This diligent approach helps ensure any infection is caught and treated promptly. Knowing when to test and following through with recommended follow-up appointments gives you clarity and control over your health. Early detection and treatment of sexually transmitted infections are key to maintaining your well-being and preventing further transmission. Taking these proactive steps can bring peace of mind and protect your future health.